want to talk about something that's not such a happy topic, but is really important. It's about mental health, and particularly dentistry and mental health. Did you know that dentistry has one of the highest suicide rates as a profession? It's sad, it's shocking, but unfortunately it's true, and it's not something that's talked about a lot. Today I'm here to discuss mental health issues within our profession and about dentistry as a whole with the incredible up-and-coming dentist, Dr. Shadi. I'm not going to say the nurse surname because I love being called Dr. Over as well as the first name. But Shadi is an incredible dentist, but also she is a colleague and a friend and feels very passionate about the subject that we're going to talk about today. As always, I'm going to ask you to subscribe and like to my channel so that you can continue to get lots of information. And today isn't the happiest of subjects, but you know, life isn't full of roses and we're not going to be talking about everything filtered and lovely all the time. So that's why I think it's a really important topic. Now, the BDA recently did a survey as well, which we'll be discussing some of the statistics, but they had also discovered that 77% of dentists had thought about suicide in the last 10 years. That's a pretty shocking statistic. And as somebody that has chosen to put themselves in the public eye, I very much understand the conflict, the dichotomy that goes on when you choose to put yourself in the public eye as a public professional. But I'm also very, sorry, I feel emotional talking about it, but I feel very passionate about respecting people online, understanding boundaries and just really being human, but also understanding what dentists go through on a daily basis because our job is difficult. Anyways, without further ado, here's Shadi, and how are you doing today?
I'm very well, thank you.
Good. Thanks for listening to me ramble on, but I understand that you're also very passionate about the subject. So obviously you are a few years behind me in my career, but you've recognised some of the stresses. So I want you to tell our audience what you've gone through as a young dentist from kind of graduating to where you are now and why you want to be more vocal about it.
Yeah, so thank you for having me first of all, and thank you for talking about this topic because it's so important and I don't think it's talked about enough. So I qualified now 6 years ago, and from qualification to now I have changed a lot in my way of thinking about things, looking after my own mental health, and I now value it very, very highly, and I make every effort to make sure I'm mentally well, and that will be the best version of myself that I can put out there for my patients, for my family. And I'll go back to my first year of uni because I think that's the most important year with me and my mental health struggles. We spoke about this previously, but I struggled going from a school where you're, top of your game, you're considered one of the brightest, if not the brightest student in the school. And that's not to brag, but that's just to give you context of, you're doing really well academically, you're doing all this extracurricular stuff that you need to get into dental school or medical school. And then you go from that situation to somewhere where everybody else is exactly like you. So there's 60 odd people in your year. My year was a very small year group. Some places have 200-300 people in the year. Everybody is exactly like you, if not better. So everybody has straight A's and A stars. And I struggled because I wasn't special anymore. So I didn't know where I fitted in. I didn't know what to do. And that unfortunately manifested itself in lots of different ways for me. And I struggled with my mental health. I was studying all the time. I wasn't socializing like you should be in your first year of dental school. But because nobody knew me, they thought that was what I was. They thought I was just a little bit strange and introverted. Now, fast forward about 10 years, and I've now realized that actually what I was going through was a big mental health struggle. And now I'm quite vocal about it because I think it's important to talk about this. And when I started dental school, this was 2010 when you qualified, and nobody was speaking about mental health, nobody was speaking about anxiety or OCD, whereas now it's almost fashionable to talk about it. Everybody has anxiety, everybody has OCD, and we understand things, like if I'm being particular about something, I'll be like, oh, sorry, it's my OCD. And everybody respects that because they know what it is. Whereas 10 years ago, nobody knew what OCD was. They didn't sort of appreciate that. They didn't cut people slack because, we're not strange. It's just how you are, and you have certain things that you have to be particular about. And now I'm very, very vocal about it because I don't think it's talked about enough. I think something like social media is a highlight reel. Everybody knows that. But if you're on social media when you're having a bad mental health day, it can be very easy to sort of spiral down a very dark path, and you just need to recognize when that's happening and get off it. And I think it's important for people who have any kind of social media following, however small or big it may be, to talk about this so that other people identify with this, and also to say, look, if you're looking at my Instagram page that's very polished, that's very all of my achievements, my life isn't like that. I've gone through so many failures to get to one achievement. You know, I qualified with honors, but I had to retake a lot of exams to get there. Like, this is something that people don't talk about, and I think it's important to talk about this so that people realize that it's normal and that you will get through it. So you can be successful and you can have mental health struggles.
Yeah. So one thing that I do want to discuss is some of the shocking statistics that are out there. I had a look at the BDA early on. Shadi and I were doing some research on mental health, and we actually found that the risk of suicide among female health professionals is 24% higher than the female national average. I think this is something very worrying, but also not surprising either, because I think generally there is a lot of pressure within the industry, and I think the pressure is it's a high demand job, but there's also the pressures to do other things in life. I did my video on egg freezing, as you know, and that was ultimately because I'm in my mid-30s and I suddenly felt the pressure of doing all the other things that I'm meant to do in society, as well as excelling in my career at the same time. I also found that it's something that people don't really speak about. Like, you know, you're just expected to, you know, find a partner, have a baby, get on with all the other things. And for me, it was really, really difficult, because I was like, oh, I've set the bar for my career, and then how can I ever fall from it? How can I ever have time to do that as well? It's interesting that you talked about other, you know, specific mental health problems like OCD. I'm not somebody that suffered from OCD personally, but I can definitely see how in dentistry that's very prominent and prevalent, because it's such a meticulous job, and I know that a lot of young people have felt the pressure seeing other people that perhaps aren't as you know, where they need to be. Ultimately, I think you know, you spoke specifically about OCD, but I haven't suffered from that. I understand how other people can, particularly in dentistry. It's such a meticulous job. And some of the reasons that people suffer from mental health, particularly in our profession, are as follows. People telling us that they hate us on a regular basis. So, you know, we can say this tongue in cheek, but a lot of dentists, it does affect them to have people come in and say, no offense, but I hate dentists. No offense, but I hate you. It's like
always no offense.
Yeah, exactly.
It's like, you take offense.
And, you know, and it's a very difficult thing to hear all the time, and studies have shown and proven that. The other reason is that, as Shadi's touched on, as high achieving professionals, if you don't do something as well as you want to do it, whether it's academically or whether it's something clinically, you put a lot of pressure on yourself and you get into kind of a deep hole of depression. The other reason is inflicting pain. Our job does sometimes involve inflicting pain, whether it's injections or, you know, having somebody tell us that it's hurting what we're doing because there's pressure buildup or something like that. So that can be extremely stressful. And then the last thing is working in a very small confined space all day. You know, we're working in this tiny little field. I love my job. Shadi loves her job, but that's not to say that we're not affected. And I think that definitely for me, on a personal level, what extends is my mental health within the social media realm. So that's, you know, exposing myself, wondering what people think. I think there's a lot of validation out there, and, you know, people have expressed this a lot on their own social media platforms, not just dentistry, that's like they put stuff out there and wonder how people react to it, whether they're being validated or not. And I think certainly that's something that I got myself into. I don't know how you feel about that. I mean, I feel like perhaps some of the other issues that you're alluding to are more, you know, relatable for you.
Yeah, definitely. When I started my social media journey, my brother had a serious conversation with me, because I think we're all by nature, you know, we're social animals. We like to be validated by our peers. And I think anyone, doesn't matter how big or small your social media following is, if somebody says something negative about you, it's going to affect you. It doesn't matter how thick your skin is or whatever. For me, it started with TikTok comments. And as you know, with TikTok, one video can go really, really viral, and 8 million people can give you their views of what they think of you. And, you know, statistics, laws of physics, no one's going to, all of those 8 million people will like you. There will be some of them who don't like you, who have certain opinions about what you're doing. And I think definitely if you're going to go on social media, then you need to be ready for it. But it doesn't mean that it's okay, it doesn't validate it. And I always think with negativity on social media, I think we all have our opinions about people and situations and things. It's one thing thinking negative thoughts, but to actually come out and vocalize it, that's a horrible thing to do. I would never do that to anybody. I might not like what someone's wearing or whatever. I would never go up to them and say, I don't like your dress, because they clearly do. So I think this is, for me, something that was difficult to struggle to get to grips with initially. But I think you need to look at the bigger picture. If what you're trying to achieve is going to outweigh those little negativities that are going to come into that, then that's enough reason to carry on. But it does take a lot of inner work. It does take a lot of social media free time in order to be able to cope with that.
Yeah, and I think the thing is that we've got to recognise that we all have to respect each other as human beings beyond, professionals. I think professional code of conduct goes without saying. It's been quite disappointing to see a lot of other professionals in the space not support each other. As we said, social media isn't necessarily something that's for everyone, but if people make the choice and they're not harming people or the profession, that's just their choice. And I think it's really important that we support each other, really, and if you have something that you don't agree with, just message someone privately. That's always my thing. You don't need to make it a public affair or a public matter. So just recognize that people that appear to be really confident, it doesn't necessarily mean that they're completely invincible. Confidence and being able to withstand things being said about you are completely different things. So I really do believe that. And if anyone in the public is watching it, obviously dentistry is a hard job, and we are doing our absolute best for you. We really, really are. And we do want to change things for you. We know that having bad experiences is something you can't just walk away from, but most medical professionals, dental professionals, aren't here to harm you. They're here to help you. And if you're really struggling with anxiety about going to the dentist, there are other means. If your dentist can't help you, you can look at having hypnotherapy, you can have acupuncture, you can have sedation if you really need to. So there are means of doing that, but working with your dentist, not against your dentist, is definitely my piece of advice for that. And let's all be vocal about mental health, because I think it's going to continually affect us. And it's not going to go away, and we need to recognise that just because you don't have the physical symptoms, like I always say, if you have a broken leg, everyone will give you sympathy and try and accommodate for you. But if you're struggling mentally, you can't talk about it, and you're expected to just show up and just do your job. But we all have those bad days, and I think the more that we talk about it, we normalise it as well. Yeah,
do you know what, this is the one thing when people, as you rightly said, I do love my profession, but there is one aspect that when people ask me what's the thing you don't like about the job, it's the thing that you have to be always switched on. So it doesn't matter if you're personally having a bad day, you have to be there 100% for your patients. And a lot of the time I find that patients are vocal about what's going on in their life. I've had loads of patients break down in my chair and cry. Like, I remember I had this patient who just had a baby, and she had the beginning of postnatal depression, and she actually came in, it was before Christmas, she burst out crying before I'd done anything. I promised it wasn't my fault, but I went and got, I think it was Christmas, so we had some chocolates, got her some chocolates. She was so happy, and to this day, this was about 2 years ago, to this day, every time she comes to see me, she thanks me for that. And I think because you have your own mental health struggles, and you have to take on the struggles of your patients, not everybody might be seeing their GP. Dentists are usually a health professional that people see regularly, and a lot of us have the privilege of being trusted by them, and they open up about their life, about their struggles and all of that. So not only do you have your own mental health struggles, but you actually have to take on those of your patients and try and help them. And at the end of the day, when you come home, you have to try and block all of that from your mind, to try and relax and have some downtime to go back and do it all over again the next day.
Yeah, 100%. And it's really important to take out time for yourself. I'm really guilty of responding to most of my Instagram messages, being there 24/7. But sometimes, you've got to protect your mind and your energy, because you want to give people 100% all the time. So the power of saying no, I always felt that saying yes to everything is that badge of honor of success, and it's not a badge of honor of success. Sometimes saying no is actually the best thing that you can do, and that means making time for things that really, really matter. So I hope that you guys have enjoyed that chat, especially dentists that have been listening to this, to really understand what happens in our world and our realm, but really to know to protect your energy. And you know, we're here to break the stigma away.
Asking for help is the most important thing, and recognizing it, and just making sure that you know it's normal.
Yeah.
Because I think that's the first step. Just don't deny it, acknowledge that it's happening if you are struggling, and get help, because that's the most important thing we can do.
Absolutely, and we're here to guide you guys if you need anything. So I hope to see you again soon, and I'm so grateful that the wonderful Dr. Shadi could be here again today. See you later. Bye.